So this is the heart auscultation skill check for Dr. Thomas. Hi Connor, my name is Dr. Thomas. I'm your physical therapist today. How are you?
I'm doing well.
I would like to listen to your heart. I'm curious about it. There are some valves in there that are important and I want to listen to them ever so closely. Are you comfortable removing your shirt and let me listen to these?
Yes.
Okay, great. So if you would do that, I'm going to get myself ready as well. Make sure my stethoscope is pointed in the right direction. And yes, wonderful. One more point of clarification, students. Make sure that your finger is not over the bell or you will hear your own pulse. So you want to straddle it like so with your hands. Okay, I'm going to feel your skin. Is that all right? We're looking for some ribs. I know that's probably pretty ticklish. Wonderful. And I'm just going to listen here. And you just keep breathing. Thinking nice, calm thoughts. Wonderful, nice job. I'm going to move across. Students, keep in mind this is the dub, the S2. Yeah, a couple cycles, make sure that sounds good. Great, we're going to move down to that mitral, or tricuspid, excuse me. Helps if you have a quiet environment, but fun to hear, right? You really can hear it. I hope you can. Real strong and pronounced. Possibly a little nervous, but it's going fine. That's really neat. And then your mitral. So good, so strong down there. That's really great. Great, sounding really good. I'm going to listen one more time, all 4 locations with the other side of my stethoscope, okay? Really nice to hear it in the bell side up here, really much easier. Kind of amplifies the sound. Really easy, very clear to pick up. We're getting way more than 2 cycles here, but just fun, right? Really fun to hear. Quite amazing. Wonderful job. Strong heart. Thank you so much. I really appreciate it. So I hope you can have fun with that, enjoying listening to those sounds. I got so excited. I forgot the last one, Herb's Point. So those 4, let's also listen to Herb's Point. Keep in mind that's for pathology, that's for abnormal, and that is in between rib 2 and 3. So it is above that tricuspid. Let's listen with both the diaphragm and the bell. I don't suspect I'll find anything here, especially with this healthy young man. But again, 1, 2, over to 2. Between 2 and 3. See if we can hear anything here. Yeah, nothing, right? And I'm not surprised, but just so you know, it's good to practice there. Again, keeping your fingers off that diaphragm, or you'll hear your own pulse. Keep on the metal components. That bell does a nice job of amplifying everything, but nothing extra. Still hear that lub-dub, lub-dub, lub-dub. Very good. All right, wonderful job. I know you'll do well. It's important to practice before we get to lab. We'll have a lot of things going on, so I hope you can enjoy this practice with this skills check. Thanks so much.